Hyperthyroidism versus hypothyroidism. Understanding thyroid dysfunction, the thyroid, a small butterfly-shaped gland in your neck, is a central regulator of your body's metabolism. When it malfunctions, either producing too much or too little thyroid hormone, it leads to distinct conditions: hyperthyroidism, overactive thyroid, and hypothyroidism, underactive thyroid. These disorders affect millions, with women being disproportionately impacted, and understanding the differences is crucial for timely diagnosis and effective treatment. What causes thyroid imbalance? Hyperthyroidism arises when the thyroid gland overproduces hormones, accelerating metabolic processes. A common cause is Graves' disease, an autoimmune disorder where the immune system stimulates excessive hormone production. Other causes include thyroid nodules or inflammation. Hypothyroidism, conversely, occurs when the thyroid doesn't produce enough hormones, slowing down metabolism. The most frequent cause is Hashimoto's disease, another autoimmune condition where the body attacks its own thyroid cells. The prevalence of hypothyroidism is significantly higher than hyperthyroidism. Roughly 5% of the U.S. population is diagnosed after age 12, compared to 1 in 100 with hyperthyroidism. Women over 60 are particularly susceptible, with estimates suggesting that 1 in 8 will develop thyroid disease in their lifetime. Family history, radiation exposure, iodine levels, and existing autoimmune conditions like type 1 diabetes can also increase risk. Recognizing the symptoms of these conditions are often subtle, but can dramatically impact quality of life. Hypothyroidism manifests as fatigue and sluggishness, weight gain despite no change in diet, dry skin and brittle nails, constipation, muscle cramps, depression. Hyperthyroidism, in contrast, presents with rapid heartbeat and palpitations, unintentional weight loss, anxiety and irritability, sweating and heat intolerance, difficulty sleeping, muscle weakness. Notably, the weight changes are often the most noticeable, but they can be misleading. Weight gain and hypothyroidism may be linked to decreased activity due to fatigue, while weight loss and hyperthyroidism isn't necessarily healthy. It often accompanies debilitating fatigue. Diagnosis and treatment options. Diagnosis typically involves a simple blood test measuring thyroid-stimulating hormone, TSH, thyroxine, T4, and triiodothyronine, T3 levels. High TSH suggests hypothyroidism, as the pituitary gland overworks to stimulate an underactive thyroid. Low TSH indicates hyperthyroidism, meaning the thyroid is already overproducing hormones. Further testing, like ultrasounds or biopsies, may be needed to rule out nodules or cancer. Treatment approaches differ based on the condition. Hypothyroidism is usually managed with synthetic thyroid hormone replacement, levothyroxine, taken daily for life. Dosage adjustments are common to maintain stable hormone levels. Hyperthyroidism can be treated with antithyroid medications, methimazole or propylthuracil, to reduce hormone production. In some cases, radioactive iodine therapy or surgery, partial or full thyroidectomy, may be necessary. Radioiodine can sometimes swing the pendulum too far, inducing hypothyroidism that then requires hormone replacement. The bottom line: thyroid disorders, whether overactive or underactive, significantly impact health. Recognizing symptoms, seeking prompt diagnosis, and adhering to prescribed treatment are essential for managing these conditions and improving well-being. Early intervention not only alleviates symptoms, but also prevents long-term complications.